evening and welcome to another edition of our COVID-19 pandemic update on Channels Television in collaboration with the Ford Foundation. I'm Millicent Umoka. Here are some of the highlights this hour. Today, Presidential Task Force gives guidelines on easing restrictions, government offices, banks to reopen, but schools to remain closed. More rights violations as National Human Rights Commission receive over 90 complaints in the second phase of lockdown across the country. And Nigerian businesses restart after the United Arab Emirates eases some of its lockdown measures. Now, by next Monday, Lagos, Ogun State and the Federal Capital Territory are expected to witness a gradual ease of the lockdown measures put in place by the president, which started over a month ago. As we count down to that date, what do we need to do in the midst of a pandemic still ravaging the global community? One important thing is to increase the enlightenment of the vulnerable group, because apart from the doubts of some, a number of them hide when they have confirmed their status. Healthcare workers also need more working tools, that is. And another thing we need to ensure as well is more testing takes place. Isolation centers are established and contact tracing is intensified. Our theme today takes a look at the processes involved in the gradual easing of the lockdown as we battle an invisible enemy. Now let's update you with the figures from the Nigeria Center for Disease Control (NCDC), which puts the total number of confirmed cases of coronavirus at 1,532, with 195 cases reported last night, the highest number in a single day. The death toll has also risen to 44, and 255 persons have been discharged. Here's a state-by-state breakdown showing the top three, that is Lagos, Abuja, and Kano, followed by the other states. Now let's give you some more information about the number of cases, starting with what we have. You've been hearing the flattening of the curve. Well, this is Nigeria right now in terms of our confirmed cases from the very first index case in February up to the point of last night when we had the highest figures of 195 added to the numbers. And as we can see, it's an upward curve, so to speak, perhaps even a slant. And when you hear people talking about the plateau of this kind, then it shows that we're not in any way reaching the plateau, which perhaps has also been confirmed by the Presidential Task Force and also the Minister of Health with regards to where we are. Since we're still seeing more transmissions, local transmissions, community transmissions across the country. If we move from here, we also see that this pie chart draws your attention to the number of persons. Since the very first day, we're having 80% of people who are still taking treatment. That's 8 out of every 10 person with the virus are still receiving treatment, and our mortality rate is increasing. Compare it to perhaps places like Italy and Spain, where their mortality rate as at March was about 6.7%. When we move away from here, we'll take you to this graph showing the number of active cases. And, you know, many people say this is the figure that we have of confirmed cases. But when you subtract total discharge and the number of deaths, sadly, you have the number of active cases that we still have across the country. I must also mention that we have tested over 12,000 people at the latest, and that is 500. We're averaging between 570, 78 per day of tests so far. Now, a breakdown across states show that it's gotten to 33 states, including the Federal Capital Territory. We're seeing a breakdown of the number of cases, and where we have more of the cases, of course, the epicenter being Lagos there with 844. We're also seeing the areas that you're seeing in white, Yobe, Kogi, and Cross River, don't have any confirmed case as at now. We're hearing a bit more information from Kogi State saying that The governor there saying he has an app that tests or that can check for COVID-19. Of course, the NCDC hasn't affirmed that. But then this is Nigeria in terms of the affected states and some of the virus-free states. Let's take you over to perhaps the molecular laboratory network. We'll come back to this shortly, but I'd like to tell you what our level of preparedness is, looking at it in the 3 S's. I call it space, supply, and staff. First, space. We heard from the Minister of Health today talking about how much more we need more isolation centres. All hands should be on deck to ensure that we have more isolation centres across states. And isolation centres could also be treatment centres. Lagos is going a step further. They have 26 collection centres in 20 local government areas. On the issue of supplies are what indeed tools our healthcare practitioners get to work with. We're looking also at the molecular labs and hoping that they are properly equipped to intensify testing, also the PPEs and the other testing kits that are needed. So far, 17. We'll come back to this here. We have 17 completed laboratories across Nigeria, and we have 1 in progress, and that's in Port Harcourt. You can also see that there is a clear representation in the regions of the molecular labs. And I'll come back to the last, and which is staff. The president, in his briefing this week, said that over 10,000 health workers have been trained. We need a lot more. We also know that there are several efforts with accrediting private hospitals and healthcare workers to join in the fight on this pandemic. So far, these are the areas we are looking at, talking about Nigeria and its efforts to battling this pandemic. Let's take you now to the Presidential Task Force, which in its briefing today hinted that the committee is working out guidelines for the gradual reopening of the country. The Secretary to the Government of the Federation, Mr. Boss Mustafa, said it is a 6-week proposal that will allow for the restarting of the economy in 3 tranches, 2 weeks each.
2020. The Presidential Task Force has developed sector-specific guidelines. The gradual reopening of the economy will span a total of 6 weeks, broken into 3 tranches of 2 weeks each. The first strategy is designed to reduce the pains of socio-economic disruptions while strengthening our public health response, which would ultimately reduce the recovery of our economy and provide succor to the poor and vulnerable. To underscore the collaborative efforts with sub-national levels of government, they are encouraged to provide leadership in engaging relevant associations responsible for various sectors.
For the Minister of Health, even though progress has been made with the number of COVID-19 patients treated and discharged, there is a pressing and urgent need to prepare for isolation centers across the country.
255 persons have been successfully treated for COVID-19 and discharged to go home, and sadly, 44 fatalities have been recorded. The increasing figure of confirmed cases underscores the ongoing community transmission, which is a major challenge, and again necessitates a call on all of us, all citizens, not to take COVID-19 lightly, but to take ownership of initiatives for non-pharmaceutical interventions with strict adherence to public health advisories. Another pressing urgency is the need to provide and prepare isolation centers and more bed spaces in all states of the Federation. I wish to apply to each state authority and Federal Capital Territory to give first-line attention to this requirement in order to meet expectations and obligations. As testing ramps up, the need will become more and more obvious. It should therefore be prioritized so that we are not taken by surprise.
The National Coordinator director of the task force, further explains that in the new guidelines by the PTF, government offices will open, schools are to remain closed with online learning encouraged, while banks are also to reopen. Joining us for more on limiting the spread of the pandemic is Dr. Blossom Madua-Fowa. She joins us via Skype from Lagos. Thank you for joining us at this time. I must quickly ask you...
Thank you for having me.
All right, good to have you. Looking at the lockdown and the gradual easing of the lockdown in Lagos, the FCT and Ogun State, we have several other areas that, state governors are taking different measures. But are you happy in assessing how we've fared so far? Would you say that it helped? And do you think this is the right time to ease when we start easing on Monday?
Okay, so that's a very good question, because what we had done initially was to sort of adopt, cut and paste what we had seen the West do, and then we implemented it in our situation. But we do know that our situation is completely different. So we have the issue of, we know that 80% of this country lives below $1 a day. And if we cannot provide palliatives for these individuals, then we have to have common sense sort of solutions to sort of have social distancing, but also to take into account the fact that people are going hungry. And so this is why there's sort of an easing of the lockdown. So but what people need to understand is on Monday, May the 4th, people are not just going to run out in the streets and do what they did before. It's not going to be business as usual. So that there's an easing of the lockdown. So people need to understand that the same practices will still come into effect. Basically, if you don't need to go anywhere, you still stay at home. Practice personal hygiene, hand washing, up to 20 seconds, use your hand sanitizers, have mandatory wearing of masks. So we're easing the lockdown, but we also understand that we need to keep this outbreak in check.
All right, Blossom, we'll come back to you because I slightly disagree because of what we're seeing. Seeing that, this week lockdown is in place, but it seems everybody is out on the streets, and that's Lagos where I am. But we'll come back to you. We'll quickly take this short break. Still to come as well, we'll be assessing the second half, talking about the various human rights violations in the second phase of the lockdown and other states across the country. That's in a moment. Welcome back to the program. We've been talking with Dr. Blossom Madua-Fowa, a public health physician, via Skype in Lagos. Blossom, I must quickly ask you, talking about perhaps the discipline that we have to also know that this is not a free-for-all, that we're still in a pandemic.
Absolutely.
And we need to take the necessary precautions. The World Health Organization said, slowly ease restrictions, don't ease restrictions right away. Do you think you can guarantee that we won't have more cases, a spike? We definitely don't want what happened during the Spanish flu era in 1918, in which was the second cases became even higher than the first outbreak.
Absolutely, absolutely. So no, we cannot guarantee that. So if you're asking, can we guarantee that? We definitely cannot guarantee that there won't be an upward spike of the cases. But what we can do and what we are doing is making sure that we're putting the message out there that this is not a free-for-all. You need to remember the protocols that we put in place during the lockdown have to be continued. So this is something using platforms like yours, this is something we're getting out across to the public. So everybody needs to know that this is an easing, this is not like a breaking open. So everything that we did during the lockdown, we need to bear in mind that we need to keep doing. It's just that we're opening up the economy so that people that need food, people that need resources can get those resources while we're trying to keep this pandemic at bay.
We can also protect them. We'd like to thank you, Dr. Blossom.
Absolutely.
Thank you for joining us.
Thank you so much for having me. You're welcome.
And states continue to adopt varying measures to curbing the spread of the pandemic. And according to the NCDC, an infectious disease reference lab is in progress in Benue State, a new approach to deal with COVID-19, Lassa fever, tuberculosis and HIV to coordinate response for the region. The NCDC Incident Case Manager for Benue discloses during the review meeting of the state's COVID-19 Action Committee following the release of 20 million naira as part of the state's counterpart funding for the project. And workers in Kaduna State under the umbrella of the Nigeria Labour Congress rejected the deduction of 25% from salaries of senior civil servants in the state, demanding the immediate reversal of the decision by the state governor, Nasser El-Rufai, to return the deducted fund or face action from the union. The Kaduna State government had at the weekend announced it would deduct 25% from salaries of civil servants and top government appointees receiving above 67,000 naira to provide palliatives for vulnerable citizens. And in the FCT, federal government has commenced training of primary healthcare workers, relevant community resource groups to respond appropriately to the COVID-19 pandemic. And now the suspected cases while continuing to provide quality primary health care. Flagging off the virtual training, the Minister of Health explains the healthcare workers are strategically positioned to contribute to the decisive actions required to curb the scourge. And finally, Ebonyi State recorded its second case of COVID-19 just 3 days after it recorded its first case. According to the government, the second case is a 27-year-old man who returned to the state from Asaba Delta with his 7-month pregnant wife. The young man tested positive twice, while his wife negative twice. Now, rights activists have condemned the spike in the number of cases of rights violation during the 1-month lockdown order in Lagos, Ogun and the FCT. They say the situation has continued unabated despite reported cases and insist that issues of rights violation should be the national consciousness of all. Well, after the first lockdown, the Commission, talking about the National Human Rights Commission, they've been documenting rights violation across the country. According to the Commission, 95 violations in total were received in 27 states, including the FCT. Enugu had the highest violations with 11 violations received, followed by Imo and Delta states. Anambra and Rivers had 4 each. The FCT and Lagos had 5 each. And some of the areas of violations include extrajudicial killing, unlawful arrest, torture, and the likes. Well, joining us on the program right now is a legal practitioner, Mr. Ben Agu, Head Human Rights Violation Monitoring Department. He joins us from our Abuja studio. Thank you for joining us on the program.
Thank you, Millicent. Good evening, viewers.
All right. Mr. Agu, the first phase, when we had the a representative from the Human Rights Commission, he talked about the number of violations that were recorded in the first phase. Now we're seeing this document about the second phase. Comparing the first two, where did we record a lot more incidents of violations, at the first phase or the second?
I think we are recording more incident this time around because it does seem that the law enforcement officers are actually not working according to their terms of professional engagement.
Looking at some of the reports now, in the first phase, Lagos recorded the highest cases of rights violation with 28 incidents, followed by the FCT 10, while Enugu recorded 9 incidents. And we're seeing Enugu topping the list in the second phase. What's really happening in Enugu, and who are responsible for these violations?
Well, we would actually know why the numbers are up now more in Enugu. But all we need, what we found out is that the law enforcement officers, it looks counterintuitive, so to say, that are supposed to protect and promote the human rights of Nigerians are not doing that while trying to enforce COVID-19 regulations. So making it now to for us to find out in Enugu that they have about 11 incidents of violations in there, most of all involving the police, the Nigerian police.
All right, Mr. Agu, we have a social media video talking about 2 police officers that captured this social media video assaulting a woman in an area in Osun State. Now, the 2 police officers we hear have been dismissed. The statement from the police command says the officers were arrested, tried, and found guilty. This is really, one of the things we're seeing across the country. But essentially, how did you collate in terms of getting perhaps some of these violations across? How much videos did you receive? How much calls did you get in documenting the number of violations? And perhaps finally, what indeed are you doing to perhaps put closure and see that we don't have increased cases of these violations?
Okay, as you are aware, the National Human Rights Commission has offices across the 36 states of the Federation, including Abuja. So we deploy our monitors to work with the state officers in these areas to collect and look at what is happening and revert back to the headquarters to enable us follow the natural, the normal referral paths we have said to make sure that these things are redressed. Actually, we have a kind of referral path through which we follow up to find out who are involved and why they have done what they have done, and of course insist that they face the consequences of their act by their respective employers at different levels of government.
All right. Mr. Ben Agu, Head Human Rights Violation Monitoring Department, I'd like to thank you for joining us on the program.
You're welcome. Thank you for having me.
Outside Nigeria, more countries are reopening their economies following weeks of lockdown to curb the COVID-19 spread. One of them is the United Arab Emirates, where some Nigerians in Dera business district of Dubai are coming out for fresh air after the last 3 weeks lockdown there. Our correspondent reports that their businesses have been impacted, but also they are testifying of communal bonds strengthened in the community as a result of the lockdown. Of course, the Nigeria Center for Disease Control works closely with states. You can find the latest national strategy to scaling up access to COVID-19 testing in Nigeria and other public health advisory. Also, the World Health Organization has live updates and indeed strategies on how they're working tailored to local context to stop COVID-19. And that's our program this evening. Thank you for watching. I'm Millicent Walker. Another update comes your way again at 9.